In a move to rein in the rising cost of insulin, Walmart is unveiling its own private label brand. The retail giant says its products will save diabetes patients up to 75% of what they're paying now, which could cost hundreds of dollars a month. A vial of Walmart's insulin will now cost about $73, a box of injectable pens about $86. The American Diabetes Association estimates 8.4 million people in this country rely on those daily insulin injections. Joining us now are Lisa Gill. She's Consumer Reports investigative reporter for Health and Medicine, and our Dr. David Agus. Good morning to you both. Lisa, we're going to start with you. I would imagine everybody benefits when the prices are lower. I don't know anybody that doesn't want lower prices on anything. But do some people benefit more than others in this case?
Absolutely. We know from multiple nationally representative surveys over a decade that when people cannot afford medication, they don't fill prescriptions or they skip doses. And we also know from a very recent survey of nationally representative of Americans who have diabetes that 1 out of every 5 people told us just at the end of last year that they struggled to pay for for their supplies and for medication. So this sort of move today with Walmart is extremely helpful. Also helpful for people who have insurance but who may have not yet met the deductible. So that means they may be paying $1,000, $2,000, $5,000 out of pocket before their insurance even kicks in. And it also may be helpful for people who have insurance but whose insulin just simply isn't covered. So it gives them yet another option, which is a very, very good thing.
David, some people may be worried about the quality of this insulin since it's so much cheaper. Will the Walmart insulin be the same quality as brand name insulin products?
Oh, yeah. I mean, it's being made by a company called Novo Nordisk, which is one of the top 3 suppliers of insulin in the country. And it's going to be quality. I mean, the regulations now on generic drugs are very good. Walmart sells several hundred drugs for $4 with no insurance cost a month. So these are quality drugs, and they can fight most diseases that we all face.
So, Lisa, what impact could Walmart's move have on this industry?
Oh, it really could be huge. And, you know, they've been a longtime leader in offering low-cost supplies and as well as the $4, $10 drugs to Americans for a really long time. Hopefully here it will put sort of continued pressure on pharmaceutical companies to keep those really great sort of out-of-pocket discount programs, coupon programs, and patient assistance programs low and affordable. So I would say the more attention that is brought to this issue, the more that people realize that they don't really need to pay more than $100 or sometimes even $35 out of pocket for their insulin. It's a very, very good thing.
Hey, Dr. Agus, insulin in America costs up to 10 times more than it does in other countries. Why is that?
You know, it's a great question, and certainly we have a runaway train. It's a predatory practice. It costs 10 times more because they will be paid 10 times more. And that's not right. You know, when Banting identified insulin in 1923, he declined to put his name on the patent because he didn't think it right to make a profit on something like insulin that would save people's lives. So we have to go back toward value-based pricing in our country because otherwise it's not sustainable.
Lisa, do you think this is likely to have an impact on the price of insulin overall?
You know, we would hope so. I mean, we've already, some of my investigations have shown that surprisingly, after the 3 big drug makers that make insulin were called before Congress about 2 years ago, those companies started to really try to offer direct-to-consumer, lower cost pricing, either through coupon programs or patient assistant programs, as a way to sort of mitigate this problem and really cut out middlemen who often, just because of the nature of that system, can unfortunately artificially increase prices that are felt by the consumer. It put pressure on them to lower prices. I think this move by Walmart will continue to do that and really shed a light on just how low those prices can go when you go direct to consumer, when you go direct through a retailer like Walmart.
We're going to go, David, but before you go, random question here. We were told right before we came on the air not to use the term diabetics, that we should now say people with diabetes because diabetics is considered offensive. Is that true? I just want to make sure we all get it right.
It is the standard now to say it's people with diabetes. And there's type 1 that requires insulin and type 2 that may or may not require insulin.
All right. Now we know.
Dr. David Agus, Lisa Gill, thank you both.